name's Lauren. How are you? Good. So I'm going to be your occupational therapist. I'm going to try to work with you on some activities that you told your doctor that you're having a hard time with, like dressing, feeding yourself, stuff like that. Does that sound good to you? Great. Awesome. So I'm just going to wash my hands quick. Come. And the first thing that I'm going to do with you quickly is I'm going to take your blood pressure because your doctor did tell me that you're a little bit hypertensive. So we just want to make sure that you're safe to participate in our activities today, okay? So I'm just going to take your arm. I'm just going to have you rest it right here. Thank you. I'm going to get and this is going to feel a little bit tight on your arm, okay? All right, so it looks like we're all set. You're within normal limits, which is good, and so we can go on with our other things that I have planned for us today, okay? Yay. So the first assessment, or thing that I'm going to have you do, is I want to see how well your arms move. I know that you are experiencing some lack of being able to use your right hand. Your doctor said you're a little bit flaccid, so your arm doesn't really work. Has that been hard for you? Very hard. Yeah. So I just want to kind of see where exactly your arm is, especially compared to your nice, healthy left arm. So what I'm going to have you do is, can you please lift your arms to your side for me as best you can at the same time, all the way up? Good. Is that as far as you can go with your left? Okay, and then back down. And how about forward in front of you? Can you do that? Do you need me to move you back a little bit? Here. How about now? Okay, good. So you're there. I see a little bit of something in the arm, but not much, and you're trying as hard as you can, I'm sure. Next, I'm going to ask you, can you bend your elbow for me? Good. Okay. And then if I asked you to hold your arms out like this, could you rotate your shoulder? Good. And then the other way? Good, and then I just want to look quickly at your wrist. So if I was to ask you to put your palms facing up and then face down, can you do that for me? Good, and then back up. How about flexing your wrist? All right. Okay, and then your fingers. Can you move all your fingers for me? Okay, thank you. All right, so that was great. The next little assessment that I have, it's going to kind of give us a picture of, you told me that you were having issues performing, your morning routine or like tasks that you have to do, whether it's grooming yourself or bathing or anything like that. Not just because of your arm that you're not able to use right now, but you said that sometimes you have a hard time remembering what to do, right? Mm-hmm. So what we're going to do is I have some objects here, and we're going to see if you're able to remember what you do with them, okay? So if I showed you this, what would you say that this was?
Brush.
Yes, good. So if I gave you this brush, what would you do with it? Good, good. It's a hairbrush. Awesome. So what if I gave you this? So do you know what this is?
Marker?
Yeah. And so if I gave you this marker, what would you do with it?
Draw?
Yeah. Good. Thank you. How about this guy? Do you know what this is? Can you tell me?
Brush.
Yep. And so what would you use this for? What kind of brush is it?
Tooth.
Yeah, good. Awesome. How about this guy?
Spoon.
It's a utensil.
Fork.
And you know what to do with this one, right? Good. And then the last little part of this assessment is I just want to see you copy the movements that I do, okay? So I'm just going to ask you to do what I do. Good. Okay, so that was great, and that's going to give us some stuff to kind of go off of as we grow and as you recover. So based off of what you've told me that your goals are for yourself, a goal that I kind of have for you is for you to be able to have a morning routine that you can do all by yourself. Because I know that being independent and getting ready in the morning is something that's really important to you, right?
Mm-hmm.
Especially when, you have things to do that day. We want a nice, easy routine that you can do, and then you can go and you can watch your grandkids, or you can go and you can hopefully someday go back to work, right?
Thank
you. What I
you.
thought that we would do first is make a list that's a nice, easy reminder for you on those days where maybe you're like having an off day and you just need that extra little something. So I thought we'd make a nice big list for you to look at in case you're ever having those issues, So we're going to call this our morning routine. I'm going to write that down. And can you tell me the first thing that you'd have on your list for your morning routine? What would you usually do first?
Brush teeth.
Okay. Is there anything that you think goes along with that maybe you could get done at the same time?
Hair.
Yeah. So first on our list is brush, teeth, and hair. That's good. Okay, and then what do you think would come next for you?
Dressing.
Dressing, okay. So getting dressed for the day. And then what do you think would come next for you? Well, what on your normal day, what would you want to do next?
Breakfast.
Okay, so eat breakfast. So if I was to give you this list and maybe we got it laminated or something like that and it was something you could keep with you in the bathroom, do you think that this would help you?
Yes.
Okay, awesome. Okay, so now that we have this list here, I think it would be a good idea for us to practice doing some of these things and work through them together. Does that sound good? That way when you're home alone and you're doing these things by yourself, which you want to be able to do, it'll be a little bit easier for you, okay?
Mm-hmm.
So another thing that I think would be a good idea for you, since we have this arm that's not really working for you, one thing that we can do to kind of promote the use of it and hopefully, eventually heal it is some weight bearing. So what I would do is I would have you put your arm up on the surface right here. So right now this table, but if you were, at a sink or a counter cooking or something like that, you can put it up on there and then lean forward. So do you feel pressure on this arm while you're leaning on it? So if you do that while you're doing some activities, that'll help promote a little bit of almost use of it. So we're going to do that for now. And then also if you think of it when you're doing things by yourself, it would be a good way to help you recover, okay? Does it make sense to you? And you can also use your left hand to, put it on whatever surface you need to. You think you can do that? Okay. So you said on your list that one of the first things that you do in your morning routine is to brush your teeth and your hair. So can you grab for me what you would use to brush your teeth? Good. And so what would you put on your toothbrush in order to brush your teeth?
Paste.
Yep, you would put toothpaste. So do you want to show me maybe how you would put the toothpaste on your brush for me? Good. Awesome. Okay. And then you want to go ahead. You don't have to actually brush your teeth, but you want to show me what it would look like if you were brushing your teeth. Good. And then along with that, which I think that it's a great idea that you put these two together because you're in front of the sink, probably with a mirror. Do you have a mirror by your sink? So you can do these at the same time and get them all set up. So out of these objects, which one would you use to brush your hair? Good. Yep. The next area that we want to look at, because you are having a little bit of a hard time with it, you told me, right, is dressing. Can you maybe explain to me a little bit what you're having a hard time about with the dressing?
This hand
Yeah.
into the sleeve.
Yeah, because you can't use it, it's a little bit trickier, right?
Mm-hmm.
Okay, so I brought from your closet this button down, which is a great type of clothing for you to wear right now, especially because you're doing most of the work with this arm. So I thought we'd practice getting you dressed in this over your shirt, if that's okay.
Mm-hmm.
Does that sound good?
Mm-hmm.
So what I would have you do, you can move that arm for now.
Mm-hmm.
What I would have you do is we're always going to want to put the affected arm, so your right arm, which is the one that's not working,
Mm-hmm.
we're going to want you to put that arm in the sleeve first. So can you show me how you would do that? Oops, we're stuck. And we can use that left hand to kind of help ourselves along, right?
Mm-hmm.
Good. And then once you have that, you just pull it around and it's easy for you to... Does that make it a little bit easier for you?
It makes so much sense.
Sometimes it might be a little bit harder depending on what else you're wearing.
Mm-hmm.
But if you always remember that we put her arm, if we put that one in first, we can use that one to help you get it on. How about you try getting it off? Show me, if you think about what we just did, can you show me how you would take it off maybe?
This hand first. Yeah. I should probably get this one off first.
It might be easier if we get this arm out first, right?
Yeah.
And then you use that arm to help you. Good. That was great. You know, it's good that you think about things first and then you try them. When it doesn't work, you have to try what's easier for you, right?
Yeah.
Okay, so we'll put this out of the way for now. You want to go back to maybe weight bearing on that arm for me? Let me see. Yeah. You got it. Awesome. And then I don't have any food for us, unfortunately, but let's talk about breakfast, because you said that that's an important part of your morning routine, which it should be. You got to eat. So in order to eat breakfast, what are some steps that you have to take? Let's talk about maybe how we can make those a little easier for you.
Go to fridge.
Yeah. What do you usually have for breakfast?
Eggs.
Eggs, okay.
And toast.
Toast. So, going and grabbing the eggs and toast maybe at the same time so you don't have to keep walking back and forth, that's going to be a really good thing. And then while you're cooking those eggs, like I said, if we're leaning on that arm, it's going to be a little bit of a higher surface probably, right? But if you're leaning on that arm and you're using that to balance, but also, putting that input into it, that's going to be really great. So do you think that these are things that you could maybe do by yourself? We can still keep working on them together and keep coming up with things that are going to help you do them easier and easier, and eventually maybe even adding more things to this. But for right now, do you think that this is a step in the right direction? All right, so that's all I have for us for today. How did you feel about it?
Good.
Good, I'm glad. So I'll be back soon. Before I leave, do you want me to put you back in bed? Is that where you want to be, or do you want to stay in your chair?
Bed, please.
Okay. So I'm just going to unlock your wheelchair, and we'll roll you back. All right. I'm going to have you scoot forward for me as much as you can. Good. Okay, let's lock this. And then bend your knees for me. And I'm going to scoot my feet between you. I'm going to put this arm resting on my arm, okay? So try to leave it resting there. And we're going to count to 3, and then we're going to transfer you over to the bed. Ready? 1, 2, 3. Good. All set?
Mm-hmm.
Thank you. It was so nice to meet you.
Thank you. You too.